We haven't had a real pandemic in this country in 102 years, so we're not prepared. But in part, it's because we haven't had to be. Because of vaccines, because of good hygiene, we have managed to keep the flu at somewhat manageable rates. So suddenly something comes along and we're not ready for it. We're not used to sacrificing, if you will, staying at home, quarantining, closing businesses or schools. These are the kind of things that happened with some regularity, I think, up to and through 1918 and throughout our history. Things like the Black Death and other epidemics happened in such a way that this was not unusual. I think it's very unusual for us, and on some level, we're not used to giving up our freedom and our community, and we've seen that play out in this virus. I think we're probably less able now to give up our freedom and quarantine. This was a generation in 1918, if you think about it. They lived through World War I, they lived through the Great Depression, they lived through World War II. We haven't had to deal with any of those kinds of crises, a particularly younger generation now, and so being asked to give up anything is difficult. We don't want to give up our technology, we don't want to give up our freedom to go and do whatever we think we want. And I never want to fall into the trap of saying people in the past were better or different. I think they were human just like we were. But doing something or doing without something for 2 months was probably not such a great stretch for people who were not living with the kind of abundance that we live with now in our technology now. So imagine what this would have all been like, for instance, if the power had gone out this entire time, no electricity. So you're not even able to watch television. I mean, that's kind of the world they lived in too. The 1918 flu pandemic brought an increased attention scientifically to try to understand what made that flu so bad. And so I think you will probably see an increase in the amount of research that goes into stopping this kind of thing, in vaccines. That's what happened. It wasn't until 1933 that they identified the virus, and then it took many more decades before they could sort of recreate it. The numbers for the deaths in 19 were undoubtedly underreported. We know, for instance, that there were 750 people who died in Atlanta. We know statewide we've already lost more people than that. I suspect those numbers were far higher in 1918. But what tends to happen, unfortunately, is that flus tend to evolve just enough to escape vaccines and herd immunity. And so mercifully, the 1918 flu never came back in the same way. That's not to say it won't, or that the coronavirus will not evolve just enough to sidestep whatever steps we take in all of our infinite wisdom to defeat it. And this is the ongoing public health challenge, I guess. The good thing we have going for us now is we have things like the World Health Organization and the CDC. Neither of those things existed in 1918, and there was no real federal response. It was really left up to local municipalities or state governments. They were kind of on their own, and so every community reacted differently. We do have a more unified response. We knew that this thing was coming on some level because of the World Health Organization and what happened in China. All those things were missing. Now that's the big 10,000 foot level. On a medical level, of course, we have intensive care units. We have ventilators. We have antibiotics. They're quickly working on a flu vaccine because we understand this is a virus. In 1918, they didn't really even understand that what they were working on was a virus. So we have all sorts of advantages now that they didn't have in 1918, but there's still the great unknown of not really knowing how this plays out in the end. I think it's an object lesson in the fact that no matter how advanced our technology, no matter how smart we think we are, on some level we're not very far ahead of our ancestors, and that it really brings the past into the present in a very visceral and sometimes dangerous way.